Hello. Hey, folks. I'm here. I don't know if you can hear me or not, but I guess to ask your questions, you type them into the chat box and then I can see them. Looks like I saw a question about which company makes the probiotic that I talked about. And the name of that company is Newbiotic, Newbiotic. And they have a website and it talks about that study and it talks about the probiotic. And there should be a way to contact them to find out what their plans are, when they might start enrolling, whether there's any kind of expanded access that you might be able to take advantage of. I see one question here from Amanda. Are there any other plans for further research from the ALS Untangled ALS reviews? Well, we certainly are going to continue ALS Untangled. We continue to get huge numbers of requests for new reviews, lots of people voting on the topics that are on the website. There's still a lot of downloads on the reviews that we write. We're in the process actually of a major overhaul of our website. So hopefully in the next week, we'll have our new website up that we think will be even easier for folks to use. And if you mean research where we're actually doing clinical trials of some of the things we've written ALS Untangled reviews on, yes, those continue to happen. So several years ago now, we wrote a review on fecal transplants. And as I showed you, now there's an Italian group that's doing a trial of fecal transplants in ALS. There are trials going on of L-serine, which is another thing that we reviewed, of Therakerman, which I've talked about. And there's other products that we've written ALS Untangled reviews on that I would love to do research trials on. Like, for example, I think Protandim is a very interesting product. It's just, unfortunately, right now, it takes a long time to get these trials funded, get all the approvals, and get the trials going. As you know, I've been talking about Theracarmen for a couple of years now. It's been more than 2 years of work to get this trial finally to open now. But maybe, what we might learn from the platform trial that the Healy Center is doing is that maybe we can build a platform for studying some of these supplements. And that, if we do that, maybe we can plug different supplements into the platform and study them much more quickly and with far fewer resources. So some of the other questions that I see, is there an over-the-counter probiotic that you'd recommend? No. And, the reason is I don't know what should be in there yet. I mean, we only have some hints from some of those studies that we talked about. Some of the studies showed that people with ALS might have reduced bacteria that can produce things like nicotinamide and butyrate. And in the animal studies, it looks like a bacteria called Akkermansia can slow progression. And at the same time, bacteria like Ruminococcus and Puribacteroides can speed progression, but that's animal studies. So I think, we're still really very early in the research about the microbiome in ALS. I think we're far too early to know exactly which probiotic a person with ALS should take, if any. And someone asked about special diets. in ALS? And again, I feel like that's kind of the same question. We know a little bit about diets in ALS. We certainly know that people with ALS who lose weight start to progress faster. And, it sounds like kind of a trite thing, but it's not. It's very difficult for people with ALS to maintain their weight. It takes a lot of work between them and their families and their clinic nutritionist to be able to stabilize weight. But we do think that's really important. And that's one of the problems I have. Some of my patients come and they have ideas about very unusual diets that they want to do, like the Walls protocol or, some sort of anti-inflammatory or gluten-free diet. I mean, they're all interesting in their own way. But in my opinion, there's not enough substance behind why those diets would help to justify the fact that almost everybody who goes on those diets loses weight. So for right now, what I tell patients is I would much rather see you on a diet that maintains your weight as opposed to a diet that's got theories, but no substantial evidence that it's going to help, and that will probably exacerbate the weight loss problem. Let's see, some other questions here. Will there be a controlled diet in the Therakerman trial? No. So, there's a lot of decisions to be made when you do a clinical trial. And one of the toughest decisions is what your control group is going to look like. As you know, most companies that do clinical trials have a placebo control group. And I think there's a good reason for that. The first is that they're usually looking for small effects on the order of a 20 to 30% slowing in the progression of the disease. And as a result, you need to be very careful about how you're comparing. Second, they're trying to reduce the amount of noise that's in the trial. And that's another reason why the trials are so restrictive. And third, regulators oftentimes want a placebo before they will approve a drug. So to my knowledge, the FDA has never approved a drug that was not based upon a placebo-controlled trial. But I've heard from patients over the years that they don't like placebo-controlled trials. At least some don't like them. And so I always want to have options in my clinic for people with ALS who like different kinds of trials. And so I'm looking for huge signals in my ROAR trials. And as a result, I don't think I need to be as careful about what I'm using as a comparison group. I'm going to use historical controls. And yeah, it's not perfect, but if I'm able to reverse ALS in one of these trials, if I'm able to take people who can't walk and make them walk again, I don't think anyone's going to have a question about whether that was a placebo effect. So that's the reason that my ROAR trials don't have the sort of traditional comparison groups. Oh, let's see, we got lots of questions here. Let me see if I can get to the next one here. Any studies that address the effects of diabetes and insulin on the gut? They're probably out there. The literature on the microbiome is massive. I mean, just that presentation that I gave you today took me about 4 months of nights and weekends working on it, reading the literature to try to understand it and, build it in such a way that I could explain it to someone else. I certainly didn't read every microbiome study, but, there's a website which is called PubMed, PubMed. I would invite you to go on there and study, microbiome, diabetes. I'm almost certain somebody would have looked at that. The next one, mother has Parkinson's, father has NPH, older brother had a stroke, and I have ALS. Could these all be related because our environment that we lived in for the past 20 years was common? I think it's a great question. And the short answer is we don't know. So yes, it's certainly possible, but I don't know of any easy way to figure out what might be in there that caused the disease. There aren't a lot of tests by accredited labs for toxins that exist in people's homes. I think some of the most important things that folks can do to help us understand what might be out there in the environment that are causing ALS are to sign up for registries that require the answering of lots of questions about exposures. Like, for example, the National ALS Registry has what are called risk factor modules. And I try to encourage all my patients to sign up for those. We want to get tens of thousands of patients answering those questions, because if we do, we might see that there's 5 or 6 things that they have in common in terms of exposures. And then that's how we can start to get at the answer to questions like yours. Let's see what else we got here. What's my opinion on using L-serine as a supplement? I would put it in my top 5 supplements. I think the mechanism, the theory is really solid, really interesting. I think that we have an animal model that suggests that we can at least block the toxicity of that toxin with this product. It's not really an ALS model. And another thing that I've not seen done is whether they can reverse the toxicity from this toxin with L-serine. To my knowledge, that experiment's not been done. But the good news is that there is already one published human ALS trial. It's very small. It was less than 20 patients. But it showed that people with ALS tolerate L-serine even at really high doses, up to 15 grams twice a day, they seem to tolerate. And it did show a trend toward people with ALS on the highest doses of L-serine having the slowest progression. Again, it was really small. It was underpowered to look at effectiveness, but all of that is really promising. And there is a trial going on at Dartmouth. So if you live near Dartmouth, or if you feel like you can travel to Dartmouth, I think it'd be great to consider participating in that trial. That way, not only do you get to try a supplement, probably from a reputable source, but you also contribute to our knowledge of the disease. You move us one step closer to finding better treatments. But if for some reason you can't participate, yes, that supplement is readily available. As with all supplements, there's lots of sources. Not every source, has been carefully evaluated to determine if it's legitimate, to determine if what's really in the bottle is what it says on the label. And you might think that was being very picky, but when people actually take the time to study supplements, they often find that what's in the bottle is not what's on the label. Sometimes there's actually harmful things that are included in the supplements. Like, for example, there have been some studies of supplements where heavy metals were found mixed in with the supplement, which can be poisonous. So part of the problem is that the FDA doesn't regulate supplements the way they do drugs. So what I always tell folks is if you're going to try a supplement, if it's in a clinical trial or was in a clinical trial, I myself would probably use the exact source that the clinical trial used. And I would try to maybe start off slowly and try to gradually build up the amount of the supplement until I get to the dose that's being used in the clinical trials. So I know for the first clinical trial, the source was Jomar Labs, Jomar. And again, the highest tolerated dose was 15 grams twice a day. Most people that I see that are using L-serine are using it at 500 milligrams twice a day. So, the study is using 30 times that dose. So it's a big dose. And I tell folks, it's probably a good idea to gradually increase the amount that you're taking to try to target that. And if at some point you start feeling bad, then I would titrate back down. And the way I work with my patients who want to self-experiment is I say, let's come up with some sort of rational plan. I try to encourage them to try one product at a time, but some people come in and they're already on 20 products. And if they are, I usually say, well, let's go through your regimen. Let's get rid of products that we've already studied. Like a lot of people come in and their regimen includes coenzyme Q10 or vitamin E or creatine. Well, guess what? We already studied those. We spent, millions of dollars and hundreds of patients and years of work to study those, and they don't work. So why include a supplement in your cocktail that clearly doesn't work for ALS? So I usually have them get rid of those. And I also say, if you're going to take a whole bunch of supplements, let's at least think about some sort of rational plan. Like if you're on 5 antioxidants, maybe you don't need 5. Maybe you just need one thing that attacks each different pathway. So I try to simplify the regimens as much as I can. And I say, let's stick to a regimen, for 3 to 6 months, and let's see what it's doing to you. If we're not seeing any progression or we're seeing improvement, let's stick with that regimen. If on the other hand, you're clearly getting worse on all the measurements that we make, okay, well, we can change it. And if you're on a particular product and you've kind of maxed out the dose for 6 months and clearly you're still progressing, let's get rid of that thing. because otherwise, we wind up on a huge like wheelbarrow full of supplements, and we don't even know if half of them are doing anything. So I think for people that are going to self-experiment, it's good to sit down with your doctor and have a plan like that. Get off things that have already been tested that don't work. Try to minimize the number of supplements that attack each different pathway. Try to come up with a plan for how long you're going to take something before you decide if it's working and you're going to get rid of it. People ask, what are some of the other things in my top 5 supplements? So I really like Therakerman, obviously. That's my #1 supplement right now because I'm just so excited about all the different things that it does. I'm so excited about the ALS reversals. It seems to be very safe, when taken orally. It should never be injected, by the way. But I'm so excited about it that I spent the last couple of years working to get this trial off the ground. I told you I'm very excited about the supplement Protandim. I think Protandim has a really plausible mechanism that's different than just about anything else out there. It activates a pathway called NRF2, which is like a molecular switch. When that's activated, the cells start to produce more anti-inflammatory and antioxidant chemicals, and that's actually been proven. It's not just a theory. They did a study with human volunteers, healthy human volunteers, and they showed that they could measure more of these endogenous antioxidants in the blood after a dose of Protandim. And there is an ALS reversal associated with that. A few other ones off the top of my head, I think acetyl L-carnitine. Acetyl L-carnitine is an interesting one. It's an antioxidant. There was a nice clinical trial that was done in Italy. It's not perfect. There is no perfect trial, but I think it was pretty good. And it's a fairly large number of patients on the supplement for quite a while. And it showed that people who took it progressed more slowly than people who didn't. If that had been a drug study, I think a lot of people would want to take it. But because it's a supplement, I think sometimes, doctors have some biases about those. But that to me looks very promising. It certainly warrants, further study. How many is that? Theracarmen, L-serine, Protandim, acetyl L-carnitine. Let's see, was there another one? I also think TUDCA is very interesting, TUDCA. So TUDCA is another antioxidant. It doesn't need to be taken with something that already has that mechanism. But if you've already tried those other things and you're looking for a different antioxidant, TUDCA by itself has a clinical trial that was positive. It's a European trial, fairly well designed. People with ALS who took TUDCA at the dose of, I believe it was a gram twice a day, progressed more slowly than people on placebo. TUDCA is also one of the ingredients in the medication AMX0035. And as you know, that medication was in a trial last year. And we heard in December that the results of the trial were positive. Unfortunately, we still haven't really seen a public release of exactly what that means. Hopefully we will see it any day. I believe there's supposed to be an article coming out in a journal any day now. And so hopefully, when the company says positive, hopefully we can all agree that it's a really, positive signal. The other ingredient that's in AMX0035 is sodium phenylbutyrate. And I saw somebody ask earlier, is butyrate the same as sodium phenylbutyrate? Well, butyrate by itself is one thing. Sodium phenylbutyrate is butyrate attached to a sodium molecule. So sodium phenylbutyrate is a form of butyrate. Is it exactly the same? No, but it's very, very similar. So that's part of why I think, the fact that butyrate looks like it's playing a role in the gut, and the fact that AMX0035 has a quote unquote positive trial, that seems to me to sort of support each other, that maybe butyrate really is important. So let's see what else we got here. Let's see, someone asked, how can we tell what needs to be changed in our microbiome? I think the only way is to do further studies. I think I showed you 7 studies that were done in human beings, and the results in every one of them were different. So that's really, frustrating and confusing. And I think part of the problem is there's no agreement on how these studies exactly should be done. And so if we're going to do more studies, we should at least try to all do them the same way. But I'm going to be doing this, with the Duke Microbiome Center with protocols that they believe are really solid and sound. And so hopefully I'll have more information when that study's over. Hopefully my results will agree with at least one of the previous studies. And I do know, again, that there's more other groups doing studies in the microbiome now together than ever before. So I think in the next year or two, we'll have a lot more answers about maybe what exactly is wrong. Is there something that we can do to manipulate the microbiome and slow progression? Let's see. Someone asked, do you recommend Therakerman on its own, or is it okay to mix with other supplements? Well, again, getting back to what I said before, I mean, when patients come to me and they're not on any supplements and they say, we really want to self-experiment, self-experimentation is the way we want to go about this, where either we can't be in a trial or we don't like any of the trials that we can be in. We just want to try things. I say, all right, well, let's start with Theracarmen, and here's the rationale, and here's, I think a good source, and here's the starting dose, and let's see what happens over the next 3 to 6 months on this dose. And, if we start to see that there's some slowing, if we start to see your progression is stopping or reversing, then we're just going to keep going. But if after, 6 months we see absolutely no effects of this on its own, we're going to get rid of it and try something else. And I always think, trying one thing at a time is ideal, because we haven't studied how all these things interact with each other or how they might interact with some of the other drugs that people are taking. But again, sometimes people come to me and they're on multiple different things and they want to take multiple different things. And that's just the way they want to self-experiment. And there, what I try to do is I try to say, all right, let's get rid of anything that has already been studied and didn't work. Let's try not to have too much overlap in the pathways that we're hitting. And so, if somebody were to say to me, well, I'm already on TUDCA, I'm already on Protandim, and I'm thinking about adding Therakerman, does that make sense? I would say, yeah, because I think Therakerman has a potential mechanism that's different than everything else by acting on the microbiome. There's really not good evidence that any of those other things, or really any of the many supplements that are common in my clinic, act on the microbiome. Theracarmen has an animal study showing that it changes the microbiome in mice toward a more protective, a more anti-inflammatory microbiome, one that is more butyrate producing, which makes tons of sense in terms of ALS. Let's see, again, more questions about diet, including, could a person with ALS eat anything they want? Well, of course, that depends upon what other medical problems you have. But, if you're otherwise perfectly healthy, most nutritionists are mainly focused on weight, because that's really the only evidence that we have that diet matters right now. People with ALS who lose weight progress faster. And it's very difficult to get people with ALS to maintain their weight. And so I would say that I advise people with ALS to work with their nutritionist on their team to find a diet that's safe with their other medical problems and that allows them to maintain their weight. And that's really the best anyone can do right now. And someone, asked about a keto-based diet. So yeah, I mean, like a lot of diets, there's a theory by which this could help. Keto diets elevate something called ketone bodies, which can be used as a source of energy by cells that are having trouble producing energy on their own. And we know that's true in ALS, that motor neurons are having trouble producing energy. There's something wrong with the energy production in the mitochondria. And so theoretically, things like a keto diet or things like coconut oil or medium chain triglyceride could be helpful. The problem with a keto diet, it's very difficult to maintain. It's very difficult to tolerate. And most people who go on a keto diet lose weight. And so if we have the real risk of something that we know is going to be harmful, weight loss, versus the theoretical risk of something that might help but might not, I would say I would go with the thing that we know is a risk. And so until we have a study that tells us that a keto diet helps, I advise my own patients not to do it because of the risk of weight loss. And one person had a comment that they felt like the website healingals.org and the group Everything ALS have been very helpful in terms of their mental and physical health. I mean, that's great. I think, we live in a time where there's more different groups out there. And I don't know that there's one group that is going to resonate with every person with ALS. but I definitely know that there's some groups that are going to be really good sources of information. And certainly talk with your own doctor, find out if there's a new group that you're looking at that you really like. Make sure that your doctor feels like they're giving out credible information. But yeah, I mean, if you found some groups that really resonate, that you found to be helpful, I think that's awesome. Let's see what else we have for questions here. I don't see any other ones. Oh, what advice do you have with patients with only progressive bulbar palsy who want to be proactively involved in finding a cure? So progressive bulbar palsy, in my experience, very often does turn into ALS. And so I feel like, at least in my clinic, some of the things that we do for people with ALS, we also do those in people with progressive bulbar palsy. So it's important to sort of understand that a lot of times people get these terms confused. Now, progressive bulbar palsy is different from just pseudobulbar palsy. Or pseudobulbar affect even. So progressive bulbar palsy, though, in my experience, is a motor neuron disease that does often turn into ALS. So I manage people that come in with that motor neuron disease the same way that I manage anybody with ALS. Somebody said, you state that people with ALS should maintain their weight, not lose weight. Is that true for people who are overweight to start with? So interestingly, there was a study that looked at body mass index and the progression of ALS. And guess what it found? It was actually a bell-shaped curve. People who were very thin or people who were very, very obese were the ones who didn't do well, who progressed very fast. But guess where the slowest progression was? Right around a body mass index of 30. That's actually considered to be obese. So again, I would say, it depends upon a lot of things. One of which is if you have other medical problems. If you have horribly controlled diabetes, well, unfortunately, you probably do need to watch your weight for that reason. But if ALS is the only problem and, you come in with a body mass index of around 30, at least in my clinic, our team is going to try to maintain that. And the reason that we'd be maintaining that is that there is a study that suggests that body mass index is associated with the slowest progression through the disease. A question here from my buddy Chris. She says, the Duke Therakerman trial, is there a disqualification for entry? There's not many. So like all the ROAR trials, we tried to make this as easy as possible for people to get into. But, there are some things that we need to have. So it's a 6-month-long trial. And so, we've got to have a recent clinic note where a person's numbers at least look like they can live for 6 months. So if I have a clinic note that says that, a doctor thinks a person's in the last month of their life, unfortunately, that's not going to work for the Theracarmen trial. They've got to be able to read English because the consent form and all the instructions for the study are in English. They've got to be able to use the internet and have access to the internet. And that's because we're using the database in patients like me as the main database in the study. And then there was one other rule that the FDA made me do. And this is one of the reasons I'm so happy to have the FDA. A lot of people look at the FDA and they're upset with them. And, like all of us, there's always things they could do better, but in general, they do a lot of good. And one of the things they do is they give you some oversight and some suggestions for making your studies and your expanded access programs as safe as possible. And so they suggested that I exclude people who are on any kind of antiplatelet or anticoagulant. And the reason is that there actually are some studies, some not all studies, that suggest that curcumin products might increase bleeding risk. And so to make this as safe as possible, we can't enroll anyone who's on aspirin or Plavix or any kind of medicine to thin the blood for a DVT like Coumadin or any of the newer anticoagulants. That's something that the FDA helped me to figure out. Someone says, I may be off topic. I have PLS and never have had a respiratory infection. If I do get flu or COVID lung infection, what do my hospital docs need to consider? So, we don't know if ALS or PLS by themselves make people more likely to have a bad outcome from COVID-19. The things that make people have a bad outcome include diabetes, high blood pressure, older age, and impaired lung function. So if you have ALS or PLS and have impaired lung function, then you might be at risk of having a worse outcome. But as far as what your hospital needs to know, I don't know of any treatments that are different for people with ALS that get COVID-19 compared to somebody without ALS. I mean, if you get a bad case of it, you're probably going to have to go to the hospital. You may have to go into the ICU. You may have to be intubated. And then, there's a lot of new therapies that are, I would say, still sort of experimental, like convalescent plasma from people that have recovered. And this antiviral drug, I think it's called Radicava. There's a lot of things that are really quite new that the FDA has given conditional approval for, but conditional approval means the FDA recognizes there's an emergency and they're approving something for temporary use while they wait to see what more clinical trials are going to show. Let's see, in the Theracarmen trial, would you have to stop taking all other supplements? No, but you would have to stop taking anything else that's in an active clinical trial. So like, for example, if you were taking L-serine, you'd have to stop that because it's in a trial. And, people ask, well, how come? I mean, that seems kind of harsh. I understand. And again, it's one of those tough decisions, but if at the end of the day, I have 50 people in my Therakerman trial and they're on 50 completely different regimens, it's going to be awfully difficult to know exactly what the Therakerman did as far as their ALS or their microbiome. So I have to try to keep this as simple as I can to understand what does Therakerman itself do. For people who want to be considered for the Therakerman trial, you can email me and I can copy my coordinator on your email. And I just have to say, I mean, we have had a lot of interest in this. We've been talking about it for years, so it's not surprising. We already have probably twice as many names as we can take into the trial. I'm still happy to put more names on the waiting list because I do know from previous clinical trials that many times when a person's name comes up and we reach out to them, they've decided to do something different or they might not qualify anymore. So just because you're not in the first 50 names doesn't mean you won't get into the trial. It's possible that all 50 people who are in the first 50 spots won't qualify or will have already done something else. So I would say if you're interested, just reach out to me and I'll get your name on the list. And again, I have published this protocol on the website, alsreversals.com. You can read the entire FDA and IRB approved protocol. You can take that protocol to your own doctor. You can decide if you want to do the protocol together on your own, just exactly like I'm doing it outside of the trial. Someone asked about Radicava. So Radicava is an FDA approved medication for people with ALS. And you'll travel around the United States and talk to different ALS experts who might feel differently about this. I try to explain what I see as the benefits and the burdens of each option to my patient. And I try to empower them and their families to make decisions about these things. I try not to be paternalistic and say, you should take this, you must take that, you must not take that. So when it comes to Radicava, the way I explain it to people is, there have been two studies, two randomized double-blind placebo-controlled trials of this medication. Both of them were done in Japanese people with ALS. We don't know if Japanese people with ALS are the same as other people with ALS. The first trial that was done that studied people who were a little further along in their disease and took, just about all kinds of progression, did not show a benefit. It was published as a negative study. People on Radicava did not do any better than people on placebo. The second trial was much more selective. It only took Japanese people with ALS who were in the first 2 years of their symptoms, who had at least 2 points on every item on the ALS functional rating scale, who had a forced vital capacity of at least 80%, and who were progressing at an average to fast rate on the ALS functional rating scale. And in that one trial, at least for 6 months, people on the drug progressed a little bit slower than people on placebo on the ALS functional rating scale. So that's it. That's all we know about the benefits. One negative study, one positive study, but the positive study was in highly selected, very early people with lots of function who were progressing fast. In my experience, the burdens of this medication are pretty high. You know, it's IV, not a pill. It requires so many IVs that people have to have lines inserted into their chest surgically. And those lines alone can cause problems. They can cause pain, they can cause bleeding, they can cause infection, they can cause punctured lungs. Once those lines are inserted, people who want to go on this medication have to go and get it for 14 straight days the first month, and then for 10 days every month after that for the rest of their lives. So the way I see it, the benefits of this medication right now are small and a little bit murky in terms of, you know, does it work? Does it only work in a subset? The benefits of this medication are high. So that's the way I explain it to patients. And I would say in the past year, I've not had a single patient start it. I've seen 250 new patients in the past year. I follow 430 patients with ALS, and I have one person taking it. On the other hand, Realisal, every study that's ever been done of Realisal shows that it slows progression and it prolongs survival. And, you know, some people say, well, the randomized trials say that it prolongs survival by about 3 months. That's true, but there's some real world studies that say that it might prolong survival by 19 months, which is pretty long. And the burdens of Realisal are very small. It's a pill. It can be crushed. There's even a liquid form if you can't swallow crushed pills or don't want to crush them. Very, very few side effects. Most people tolerate it fine. Only 1 in 100 people with ALS will have serious problems with their liver. And, you know, for that, we can monitor them very easily with blood tests. So to me, the benefits of Realisal are small, but definite, and the burdens are very small. And so, you know, to me, that ratio might make a little more sense. And I would say of the 430 people I'm following with ALS, about 90% of them are taking it. So someone asked about Basis by Elysium. And, you know, I would say if I had to make a list of the top 6 supplements, Basis would probably be number 6. And, you know, Basis has 2 ingredients, and they're interesting in terms of the theoretical way they work. A form of Basis, at least, called EH301, has a clinical trial that is published in a peer-reviewed journal. It is a very odd clinical trial done by a group of investigators I don't know, very small group of patients on Basis, a small but different number of patients on placebo. The trial was, I believe, only 4 months long, which is odd and short for an ALS trial. But if we can believe the results, they were pretty extraordinary. The investigators claimed that on average, the people in their trial actually improved on several measures of ALS function over 4 months compared to the people on placebo that worsened. And, you know, we don't typically see those kinds of results in our trials. We get very excited if we see a slowing in progression, never mind an improvement. And so that trial now, I believe, is at least 2 years old. And I hope that the company has another trial underway. We sort of, you know, tried to get them to work with us and to do another trial, but it sounded like they already had another group that they were working with. I just haven't seen anything on their website, and I certainly haven't seen anything presented at any meetings in the past year about what's happening with that. But I do think it's interesting. It's just odd. The other problem is I don't know exactly how the supplement Basis compares to the product EH301. The ingredients are the same, but I don't know about the doses. The company has not, you know, made public what the difference in the dosing might be between those things. Let's see, we have a question here. Am I right that PLS causes the diaphragm to be spastic and stiff versus flaccid in ALS? Yes, that's what we believe, because PLS is an upper motor neuron disease. And then it says, seems like spastic diaphragm complicates use of a respirator to treat lung infection. I've not seen a study that says that. I mean, I do know that in my clinic, people with PLS do sometimes have a low forced vital capacity, and we treat them with non-invasive ventilation, a BiPAP or a Trilogy, just like we treat ALS. And, I haven't studied this carefully, but it's been my experience over the last 20 years that people with PLS do seem to benefit, at least in terms of their symptoms. Someone mentioned they've lost taste and they've tested negative for COVID twice. Could loss of taste be a symptom of ALS? It's unusual, but it is possible for ALS to affect other parts of the nervous system. And I believe that taste can be affected. I certainly know that the regulation of temperature, heart rate, blood pressure, all parts of the autonomic nervous system can sometimes be affected in ALS. It is also possible that a medication or a supplement can affect taste. So if I had to pick one medication that I think is the most common culprit in people with ALS, it's Realisal. So, one of the rare side effects of Realisal is that it can affect a person's taste. And if I have a patient come to me and tell me that their taste seems to be off and it's really affecting their quality of life, I stop the Realisal. And I would say about half the time, it seems like the person's taste comes back in a week or two. And, if it's affecting their quality of life a lot, then I tell them they probably should stay off Realisal. Someone asked if there a time span for taking Realisal. So it's a great question. I'd say it's fair to say that up until last summer, most of us would say, if we feel like your ALS has progressed to where you're probably kind of near the end, for example, if you're considering hospice, then that might be time to consider stopping Realisal. And then a study came out that went back and reanalyzed the main Realisal trials. And it looked at people in different stages of ALS. And it turns out that Realisal even prolongs the amount of time that people can spend in that last stage of ALS. So I believe that Realisal benefits people in all stages of ALS. The one time when I think it's pretty clear that we should stop it is when somebody has a tracheostomy. And the reason I say that is that the endpoint in almost every clinical trial of Realisal was tracheostomy-free survival. So what Realisal does is it prolongs the disease up until the point when someone gets a tracheostomy or dies. There's no data that I'm aware of that show that Realisal benefits anyone after they have a tracheostomy. Someone said they wanted to sign up for the Therakerman trial and they were considering even taking the supplement. What else can they do? Well, I mean, getting back to basics, I think that some of the most important things people with ALS can do is to find a good clinic where they have a neurologist that's passionate about the disease that they can connect with, where they have a team of therapists that can monitor them from head to toe and find every little thing that ALS is trying to take away from them and give them options for compensating. A clinic that offers trials and ideally try to participate in those trials, even though sometimes I know that can be difficult because trials really are the way that we move forward as a field. So, we often don't learn much from people who self-experiment. That's one of the downsides of that, is that the world doesn't learn much. There is a way that more people can learn about the results of those self-experiments, and that is by everybody signing up for an account on the website Patients Like Me and documenting everything that you're doing. It's free to sign up for an account on Patients Like Me, and it gives you the opportunity to list everything that you're taking and to list all the measurements of your disease. And so, it's very likely that some of the people that come into my clinic and are saying, well, I want to take, Theracarmen and Protandim together. Well, there probably have been patients somewhere in the world who took that combination before. And it would be awesome to be able to go to a website and say, hey, look, I just found 25 people that did this exact combination for 6 months, and this is what happened to them. But, right now, there's about 10,000 people on Patients Like Me, but, there's about 200,000 people with ALS worldwide. So only a small fraction of all the people in the world with ALS are on Patients Like Me. So I hope that will change so that we can start capturing the results of all these self-experiments. Sometimes people say, well, there's just no trials open where I live that I can qualify for. And so I say, well, there is the Theracarmen trial. And if you can't get into that, there's another trial that's open that I think is really easy to get into and really interesting. It's a trial that's run by one of my colleagues at the National Institute of Health. His name is Dr. Nath, N-A-T-H. And his idea is that there might be a virus that causes some forms of ALS. And that virus is called HERV-K, Human Endogenous Retrovirus K, HERV-K. And so if you go on the website clinicaltrials.gov and you type in ALS HERV-K, his trial comes up. And what I love about his trial is, first of all, he's got this idea about this virus. The evidence for it is, he says about half the people with ALS that he tests have this virus in their blood, and nobody without ALS has it. And if he puts this virus into a mouse, the mouse gets a disease that looks like ALS. That is very compelling evidence. And so the way this trial works is it's entirely virtual now. He changed it during the pandemic. So you can find a contact number and email on clinicaltrials.gov. You reach out to them, they screen you over the phone. If you qualify, they send somebody out to where you are to draw your blood, and they bring it back to Dr. Nath's lab, and they check it for the virus. And if you have the virus, then he offers you antiviral drugs, which he sends to you. And so it's a really easy trial to participate in. And what I love about it is, if you don't have the virus, you don't get the drugs. There's far too few trials like this where we're looking for a cause of ALS and only treating people with the cause with our therapy. Most of the time, we're just lumping everyone together. And I think that ALS does not have one cause. It has many causes. So I love trials that go after a cause of ALS that we can pinpoint. Someone asked about my thoughts on Neuron. So, I think it's a really interesting idea. For those of you that don't know, Neuron is a stem cell protocol. And it would involve taking a person's bone marrow from their hip and isolating the stem cells, treating those stem cells in a proprietary way. So the cells would have to be sent somewhere, and the company would have to treat those cells and then send them back. And then those treated stem cells are injected back into the person through a needle that goes into the spine. They're slowly injected back into the spinal fluid. And the idea is that they would float around in the spinal fluid for some period of time and secrete growth factors. Now, there's a few things that I think people need to understand about this. First of all, I don't see how this could possibly be a cure for ALS, because it is not going after a cause of the disease. It might slow the disease down in some people. Second, you're not just going to be able to get one injection of this and walk away with your disease better forever, because the cells aren't going to last. They're going to float around and last for some period of time, which no one knows how long it is, but you're going to need more injections. And so the company knows this, and they've done a very nice development of this product. And so the first thing they did is they gave a single injection of this, which is exactly what they should have done, to see how safe it was. Very small study, and they published that paper a few years ago. And that paper showed that this was safe, and it seemed to be pretty well tolerated at a single injection. Now, if you look overall at the progression of people who got this, I don't see an impressive change. There was a small improvement in some people for a short period of time, and the company argued that that might be a response. It might be, but I think for this to go into widespread use, there's going to have to be something much, much more profound than that. When we talk about benefits and burdens, that's a small temporary benefit. This has a much larger burden even than Radicava. Bone marrow biopsies, infusions of the cells back in through a needle in the spine at a frequency of at least every month. The cost of this is probably going to be quite high. So I'm hoping that this study that's underway right now, where they give repeated injections every month, is going to show a much more profound benefit. But honestly, we've got to just wait and see what the results of the study are. Nobody knows right now what the results of the study are. It's a double-blind, placebo-controlled trial, so no one knows who's getting the real treatments and who's getting the placebo. And the good news is that we're told we're going to have the results soon, in the next few months. So I'm really looking forward to seeing if those, produce a benefit that is large enough to make sense in terms of those burdens. I'm looking to see, I think I've got everybody's question answered here. Let's see. Give me a minute. I'm just scrolling through all the questions here to see if I got them all. It looks to me like I've got them all. If I missed one, go ahead and enter it again. I see one that says, is it too late for my sister to take? I'm not sure. It's too late for my sister to take. I don't know. It looks like maybe the rest of the question got cut off. So if you wouldn't mind just re-entering that one. One person entered a question about ozone therapy. It's not near the top of my list as far as the mechanism by which that might be able to influence ALS. I've certainly not seen any, preclinical studies or any clinical trials of ozone therapy for ALS. Thoughts on glucose levels? Yeah, I think that glucose levels in ALS should be normal. If people come to our clinic and they have ALS and diabetes, we try to work with their primary care doctors to manage their diabetes, because that can create problems of its own. Like diabetes can affect the nervous system too. But as far as any special treatments to affect glucose levels in a person without diabetes, no, I've not really seen any evidence that could help. Oh, I see. Here's another question. There's something on Amazon which is called Cumin Rich Theracarmen by Natural Factors. That is not the same thing as the Theracarmen that I'm going to be studying from Integrative Therapeutics. Is it possible that one works just as well or better? Sure, it's possible, but I don't know of any studies on that particular supplement. I don't know of any studies in terms of purity. I don't know of any of the pharmacokinetic studies. I don't know of any studies of that product being injected into animals to see if it changes their microbiome. So that would not be the form I would take if I was going to take this. I would appreciate thoughts on increased glucose levels in connection to ALS. We recently read a study about it. Yeah, I've not seen that study. I'd be happy to take a look at it. It's just be careful about certain kinds of studies, like studies in animal models. They're always interesting. I oftentimes, a paper will come out and, it'll have a headline, dramatic breakthrough for ALS patients found. And when you actually read what it was an animal study. And I just think right now we don't know that the results that we get in our animal models of ALS are going to translate into people. And, so far we have found a lot of things that can slow the progression of ALS in animal models that don't do anything in people. So we have to be really careful about taking the results of an animal study and deciding to take a treatment in a person. It's okay to take those results into a clinical trial, but taking the results from an animal study and deciding that you're going to take that product is a big jump, I think. Fruit flies. Okay. Yeah. And again, once again, it's a different animal model. They're always interesting. I think they're important to keep doing. I think we need to start trying to get more models of sporadic ALS. I would personally like to see a lot more studies just happen in people with ALS. I get frustrated when I see so much attention being paid to studies in animal models, because we don't know if any of those will translate. And, I've got a lot of patients in my clinic that would love to be in studies. There's not nearly enough human studies. So I would like to see a day when a lot more things go directly into people as opposed to going into animal models of ALS, at least until we have a model that we know is predictive. Will the spice turmeric being added to food? So turmeric has lots of stuff in it. It's possible something else in there could be helpful, but if curcumin is what we think is going to work, then the amount of curcumin in turmeric is very small. So if you really want to try to use curcumin itself, I think taking curcumin makes a lot more sense. We got a couple of questions about two things that have come up, over and over again in the 20 years that I've been working in ALS, and that's Lyme disease and heavy metals. And, the short answer is I have looked every way that I can think of for a connection between Lyme disease and also between heavy metals and ALS, and I just don't see it. You would think if there really was a connection that there would be case reports that we could all point to and say, oh my gosh, this clearly is a classic, presentation of ALS. And instead they had Lyme disease or metal poisoning. And when they were treated for that other thing, they got better. And that just doesn't exist. So, with all these folks out there who are saying there's a connection, how come there's not one non-controversial case that's published? On the other hand, there are cases of ALS mimickers like copper deficiency. It's one of the things I test all my ALS patients for. There's at least 6 cases, and you read those cases and those people look just absolutely classic for ALS. And when they were tested for copper by an accredited lab, and their copper levels were really low, and when they were put on copper, the ALS-like disease in many cases went away. And the same thing's true of celiac disease. I test all my patients who come to my clinic for celiac disease because there's 3 cases in the literature and one that I've seen in my own clinic with my own eyes where the person really looked like ALS. There really wasn't anything atypical about their presentation. And when they were tested for celiac, it was positive. And when they were put on a gluten-free diet, the ALS-like thing went away. And so I test my patients for celiac. And of course, if I find somebody with celiac, like the one person that I found 10 years ago who had what looked like ALS and had celiac disease, I do put those patients on a gluten-free diet. That patient's been on a gluten-free diet for 10 years, and there's been no more progression of their ALS-like disease. So I mean, those are my thoughts on those things. Is there a test for BMAA? Unfortunately, no, not yet. There's tests that are in development, like that grant that I told you about, where they're trying to develop a stool test, which I think would be so helpful. As far as the dosage, well, again, if you're going to use that exact product that I'm using in my trial, which is Therakerman from Integrative Therapeutics, the dosage is 1 capsule twice a day. It doesn't really come in any other doses. In those capsules, there's 90 milligrams of curcumin. Could ALS benefit from some of the advances and acceptance of telemedicine and remote monitoring in healthcare? Oh my goodness, absolutely. And I've been doing telemedicine and ALS for 7 years. And it was clear to me right from the start how beneficial this can be. There's a lot of things we can measure in people with ALS by telemedicine, like the ALS functional rating scale. We can get an idea of their weight. We can get an idea of what kind of symptoms they're having that are making them uncomfortable. We can get an idea of what kind of equipment they have that's in need of repair. We can get an idea of what kind of equipment they might need. We can talk about research. We can talk about self-experimentation. So for years, the reason that telemedicine wasn't more widely used, really there were 2 reasons. First, nobody was paying for it. So the only reason I've been able to do it for the past 7 years is I do most of it at the VA. And in recent years, I've been able to do it at Duke because the ALS Association gives the Department of Neurology at Duke a grant so that I can do this for half a day a week and not charge patients for it. But in the past 6 months, one of the few good things that I've seen happen in the world is that telemedicine has exploded. The pandemic, which at least for a while was forcing people to stay home, meant that we had to think of a new way to deliver healthcare for every condition, including ALS. And so all of a sudden, people were paying for telemedicine. Just about every insurance company was paying for it. Oh, and the other barrier was for a long time, we couldn't cross state lines. So a lot of states had these crazy laws that said, you want to see people in our state by telemedicine, you got to get a license in our state, which I've always thought was crazy because I don't need a license in every state to talk to people on the phone. So why does it matter if I see a video? I never understood that. But in the past 6 months, most states have done away with those laws. Now, one big question is, what's going to happen when the pandemic is over? I hope that these changes will persist because I'm seeing a lot more patients than ever before through telemedicine. And in general, my patients really like the convenience of it. And we're even incorporating telemedicine into our research. So a lot of trials now have converted several of the visits that were supposed to be in person over to video visits. And I hope that that will continue even after the pandemic is over. Looks like that's it for questions, eh? Well, I've really enjoyed spending my afternoon with you. And I hope that next year we'll be able to be together someplace. But in the meantime, you can find my email on the Duke ALS Clinic website. Feel free to reach out to me. And always happy to answer questions. And looking forward to being able to talk to you in about a year and tell you about the results of some of the studies I talked about today. Hope you enjoy the rest of your weekend. Take care, everybody.